Psychologists have read it. When were you genuinely scared of a patient? I'm a therapist, but not a psychologist, if that distinction matters. For several years I worked in a residential facility for kids and adolescents, all with pretty intense behavioral issues. It was a challenging job, but I loved it. Even when a client was aggressive or having an outburst, I was usually able to de-escalate the situation, and I have to be honest, I generally didn't feel unsafe. Most of the time, my primary concern was for their own safety during these episodes, not mine. I saw them as kids who were hurting and didn't have the tools to cope. There was, however, one exception, one client who made me feel a kind of cold, primal fear I'd never experienced before or since. Let's call him Leo. Leo was strong for his age and prone to the most intense, explosive tantrums I'd ever witnessed. But the other 99% of the time, he was a model resident. He was genuinely charming, funny, and personable. He would help other kids with their chores. He'd ask about your day and actually listen to the answer. And he had this infectious laugh that could light up a room. We had a good relationship, and I genuinely enjoyed working with him. That's what made the incident so jarring. It was like a switch would flip, and the Leo you knew was just gone, replaced by something else, something cold and focused. The first time it happened, it was over something trivial. Another resident had taken his seat in the dining hall, a minor issue we dealt with daily, but Leo didn't say a word. He just stood there, his face completely blank. Then, I saw him lock eyes on the other boy, and he began to walk towards him with a purpose that made the air feel thick and heavy. I moved to intervene, placing myself between them and starting my usual de-escalation script. Leo, I can see you're upset. Let's talk about it. He didn't even look at me. His eyes were still fixed on the other kid. I saw his fists clench, and I knew I had to act fast. I put a hand gently on his chest to stop his advance, and that's when his head snapped towards me. The look in his eyes wasn't anger, it was void. A complete and utter absence of everything that made him Leo. In a flash, his hands were around my throat. I'm not a small guy, but the force was shocking. It wasn't the wild, flailing attack of an angry kid. It was a precise, determined attempt to choke me out. Luckily, other staff members were on us in a second, pulling him off. As they restrained him, he didn't fight or scream. He just watched me, his expression still terrifyingly blank, as I gasped for air. The whole thing was over in less than a minute, but the memory of that cold, empty stare is burned into my mind. Oddly enough, an hour later, he was back to being the polite, charming Leo, apologizing profusely, sounding genuinely remorseful, but I never looked at his smile the same way again. I always wondered what was really behind it. Story 2. I'm a clinical psychologist, and for a number of years I worked in a state prison. The work was demanding, often grim, but I felt it was important. Part of my duties involved conducting parole evaluations for inmates, which is a heavy responsibility. You're assessing risk, remorse, and the likelihood of reoffending, and your report carries significant weight. Most cases were straightforward, but one has stayed with me. It wasn't the evaluation itself that scared me, but the chilling aftermath. The inmate was a high-ranking member of a national gang. By his own account, he was the highest-ranking member in the entire state, and the prison administration had actually placed him in this specific facility to keep his own people in line and maintain a semblance of peace. He had a long and incredibly violent record. In my professional opinion, he was a genuine psychopath, not in the cartoonish movie sense, but in the real, clinical sense, a complete lack of empathy, a manipulative charm, and an inability to feel genuine remorse. Part of the evaluation involves discussing the crime that led to their incarceration. I needed to assess his insight and remorse. He was so detached, so clinical in his description of how he had tortured and left another man to die over an unpaid debt. There was no emotion, no hesitation. It was like he was describing how to assemble a piece of furniture. Live by the sword, die by the sword, was the phrase he used, a casual justification for an act of brutal violence. He spoke of it like it was just a business transaction that went wrong. He was also very nonchalant about his ability to take care of his business while inside, making it clear that his influence extended far beyond the prison walls. I had no reason to doubt him, based on his record, his psychopathy, his utter lack of remorse, and the clear threat he still posed. My recommendation was unequivocal: do not grant parole. I laid out the various factors in my report, and in the end, the parole board sided with my recommendation. And that's when the fear truly hit me. This was one of my first parole evaluations, and the reality of the situation crashed down on me. I had just stood in the way of a very powerful, very violent man, a man who could, with a single phone call, send someone to my house. I had no doubt about that. I spoke to a more experienced colleague, who told me not to worry about it. He said guys like that know the score and wouldn't take it personally. They understand you're just a cog in the system. I had a very hard time buying it. The fear lingered for months. Then, I was assigned to run a long-term offender therapy group. On the first day I walked in and saw him sitting there among the other inmates. My stomach dropped. I got through the session on autopilot, my mind racing. I knew I couldn't work effectively with this hanging over my head, so I made a decision. After the group was dismissed, I asked him to stay behind for a moment. My heart was pounding as the other inmates filed out, leaving just the two of us in the room. I looked him in the eye and asked, "Are we good?" He looked at me for a long moment, and then a slow smile spread across his face. It wasn't a friendly smile. It was a smile of assessment of power. "Doc," he said, his voice calm and even, "don't you worry. You did your job. You wrote what you had to write." He paused, leaning in slightly, "And you weren't wrong." It was true. He went on to be a surprisingly insightful and active member of the group, but I never forgot that moment. The fear wasn't that he would hurt me for telling the truth, but the chilling realization that he was perfectly capable of it, and the only thing stopping him was his own strange, unknowable code. Story 3. I'm a therapist in training, and my tutor is a specialist in childhood abuse and trauma. She's been in the field for over 30 years and has a kind of calm, unshakable demeanor that I aspire to have one day. She's seen the absolute worst of what people are capable of, and yet she still approaches every case with compassion, sometimes, to prepare us for the realities of the job. She shares stories from her past, omitting identifying details. Of course, these aren't just case studies. She calls them her horror stories. The one that has always stood out, the one that she says is the only time she truly felt her life was in imminent danger, involved a man in his mid-40s. Let's call him Mark. Mark had lived most of his life with an extreme, all-consuming paranoia. He was convinced his parents were orchestrating a massive conspiracy against him, sending people to gather information to blackmail him with, tracking his finances, poisoning his food. His world was a prison of fear. He was legally obligated to attend therapy after being caught for some petty theft, which he claimed he only did because his parents had somehow drained his bank account. For the first 6 weeks or so, the sessions were progressing as you might expect. He was resistant, agitated, but slowly, my tutor was building a rapport. He started to open up. Then, during one session, he began to talk about a plan he had for the future. He was vague, but his tone was different, hopeful. He said he had finally worked out a way to break free from his childhood and move forward, to truly start his life over. My tutor, ever the optimist, felt a mix of apprehension and hope. He had been making good progress, and this sounded like a potential breakthrough. Fast forward 1 week. Mark arrives for his scheduled session. He is noticeably agitated, his eyes darting around the room, and he's carrying a large, heavy-looking sports bag, which he places on the floor next to his chair. This was unusual. My tutor, maintaining her calm, professional demeanor, smiled warmly. "It's good to see you, Mark. That's a new bag. I like it." And with that simple, kind remark, Mark completely broke down. He started sobbing, great heaving gasps. He confessed everything. His plan to break free from his past was literal. He had a machete in the bag. His plan was to systematically kill everyone from his old life, who he believed was part of the conspiracy, starting with his parents. And then, he was going to kill his therapist, so he could be completely, utterly free from his past. He had come here today to do it. My tutor said the room went completely silent, the only sound being Mark's ragged breathing. She looked at the sports bag, then back at his face, which was a mess of tears and despair. She asked him, her voice steady, what had stopped him. He looked up at her, his eyes filled with a strange, tragic clarity, and said, "I was going to start with you, but you were just so nice to me about the bag. I thought it would be too hard to kill you." My tutor politely excused herself, saying she needed to grab a file from the other room. She walked out, her legs shaking, and called the police. Mark was completely compliant when they arrived. He had given up. The police confirmed he did, indeed, have a large, sharpened machete in the bag, and when they searched his car, it was full of bin bags and cleaning supplies. She always ends the story the same way, with a grim little smile. "The moral of the story," she says, "is to treat all your clients well, because you never, ever know who's plotting your murder." Story for my brother is a psychologist, and I'm not, but he once told me about a case that messed him up so badly he almost changed professions. He had just started his practice, running it from his house in the same city where I was going to college. Because of that, I actually knew the patient he told me about. We were both in the same economics program. I'd see him around campus all the time. He seemed like a typical quiet kid, jeans, t-shirts, always had his headphones in. The only thing remotely odd was that he carried a briefcase-style laptop bag in addition to his backpack, which just seemed a bit much. He started seeing my brother about 2 months into our freshman year, coming in for what seemed like standard depression. He felt like he didn't fit in, didn't know how to talk to people. My brother said it all felt strangely rehearsed, like the kid was rattling off symptoms he'd read in a textbook. After a few sessions, though, things took a sharp turn. The kid confessed that he sees things. He said he couldn't stand being in dark rooms alone, and his roommate had just moved out, which made everything worse. He described it as small, almost imperceptible movements in the corner of his eye, shadows that stretched and twitched when he wasn't looking directly at them. He was scared all the time, especially at night. My brother's professional concern went from depression to potential schizophrenia. This was serious. The movements apparently got worse as the semester went on. Around late November, the kid started calling my brother's work phone, which was a cell he kept on him. The calls came at 2 a.m., almost like clockwork. My brother, worried the kid's state would deteriorate rapidly if he felt abandoned, answered the first few calls. He said they were awful. The kid's voice was strained, barely a whisper, and he could hear him sobbing quietly on the other end of the line. It went on like this for days. It got so bad that at their next meeting, my brother told him he needed to refer him to a specialist and that he should seriously consider inpatient care. The kid just broke down in his office, crying and apologizing for over an hour, repeating over and over again, "I'm so damn scared." After the holiday break, the kid agreed to go to an inpatient center. Things went quiet for 4 months. My brother thought the crisis was over. Then, one night in April, he started seeing lights outside his office window. Not car lights, but quick flashes, like from a flashlight. He lived in an area between downtown and the college, so he brushed it off as drunk students. Later that night, he heard loud quick slams on his front door. Annoyed, he ignored it. Then his phone rang. He had since changed his policy on late-night calls and let it go to voicemail. The next morning, he listened to the message. It was the kid. He was screaming into the phone. Just a raw, terrified scream. "They're back, they're back, they're back." He shrieked, his voice getting faster and faster until it dissolved into choked sobs. Then, at the very end of the message, my brother's blood ran cold. He heard the kid's voice, now desperate and close, say, "I'm outside. Please let me in, please, And underneath his words, he could clearly hear the sound of someone frantically slamming on his own front door. The kid took his own life 3 months later. The part that haunts my brother the most is that he never heard the screams or the pleading that night. He had no idea the kid was right outside his door, in the grips of his final terror, until the next day. Story 5. I'm a psychologist now, but the experience that truly scared me, the one that reshaped my entire career path, happened in the 2 years between my undergraduate and graduate studies. I took a job at a residential facility for male teenage sex offenders. When I started, I was full of a kind of naive optimism. I had faith in the system, in the staff, and I genuinely believed I could help these kids. It probably took less than 6 weeks for that optimism to be completely and utterly crushed. The job turned into the single worst period of my entire life. The core problem was that the kids were smarter than the system. They knew that most of the rules were essentially unenforceable. They could constantly curse at us, threaten us, steal, break things, manipulate everyone and everything, and act out with almost no meaningful repercussions. I think it was my second day when I watched a kid, no older than 15, calmly pick up a heavy wooden chair and systematically break down a steel-enforced door. They would intentionally provoke staff, trying to bait us into a physical confrontation. They would provoke each other, forcing us to intervene so they could try to get us caught in the crossfire and injured. It was a chaotic, hostile environment, but it got worse for me personally. I've always been a straightforward by-the-book kind of guy. I enforced the rules as they were written, not because I was on a power trip, but because I thought structure was what they needed. The kids quickly learned this, and they began to hate me for it. They targeted me. And that's when the real psychological toll began. It does bad things to your psyche when someone can criticize you, lie to you, demean you, and threaten you and your family for 8 hours a day, for months on end, and you essentially can't defend yourself. You're constrained by your professional role. You can't hit them back. You can't talk back. You can't show an attitude. The only tools you have are taking away privileges that they couldn't care less about. Meanwhile, you are giving them your everything. You're helping them with basic hygiene, with their schoolwork. You're counseling them, playing games, talking them through life issues, putting them to bed at night. You're essentially their parent, and they despise you for it. I started having chest pains on the drive to work each morning. I would have trouble falling asleep at night because my mind would just replay the threats, imagining the restraints I might be involved in the next day. And yes, to answer the question, I was afraid of several of them. I was assaulted 3 times while I worked there. 2 were relatively minor, a single punch to the chest, another to the face. But one of the kids, during a restraint, managed to punch me 6 or 7 times in the head before we could get him under control. Another one, who was HIV positive, would use his diagnosis as a weapon. Anytime he was angry, he would threaten to cut himself and get his blood on us. The fear in those moments was indescribable. I finally quit. I made a vow to myself that I would never, ever put myself in that kind of situation again. Today, in my current job, we are sometimes asked to go do psych evaluations in a jail setting. It is the only function of my job that I openly refuse to do. Luckily, they've been understanding. I'd rather dig ditches for a living than ever go back to a place like that. Story 6. This one is different from other stories of fear I have. The fear here wasn't born from malice, or psychopathy, or a direct threat. It was the fear of accidental catastrophic violence from one of the sweetest kids I've ever met. He was a teenager, mostly blind, and was with us following his first psychotic break. He was gentle, polite, and had a deep love for martial arts taekwondo, if I remember correctly. And he wasn't just a casual enthusiast, he was good. Frighteningly good, because he couldn't see well. He would practice his kicks everywhere, relying on muscle memory and his sense of space. It was his way of coping, of feeling centered. We had a quiet room on the unit. Think of a padded room but without the padding. Just bare walls and a reinforced shatter-resistant window for observation. One day, during a moment of agitation, he was in there practicing. He did a spinning kick, and his heel connected with the window. It turns out shatter-resistant is not the same as shatterproof. He destroyed it. The entire pane of thick, reinforced glass spider-webbed and crumbled from a single, precise impact. That was the first time we truly understood the kind of power he possessed. The moment that genuinely scared me, though, happened a few weeks later. I was walking down the hall, about to round a corner. Just as I was about to step into the intersecting corridor, he flipped up to practice one of his kicks. He had no idea I was there. His foot sliced through the air, coming literal centimeters from my face. I didn't see it as much as I felt it. I felt the impact of the air being displaced, like a physical force bashing into me. It was so fast and so powerful that my body reacted before my mind did. I stumbled backward, my heart instantly hammering against my ribs. If I had been walking just a fraction of a second faster, he would have connected my nose, my jaw, my teeth. A lot of things would have broken. He finished the movement, his foot landing silently on the floor, completely unaware of how close he'd just come to seriously injuring me. He heard my sharp intake of breath and turned his head. "Is someone there?" he asked, his voice full of gentle concern. I managed to stammer out that it was just me and that everything was fine. The sweetest kid in the world. He would have been absolutely horrified if he had known what almost happened. But later that day, he grabbed my arm with a suddenly firm grasp. His face lit up with a hopeful smile and asked, "Hey, do you want to do some taekwondo with me?" My entire nervous system screamed in unison. No, I did not. Story 7. I'm not a psychologist, but I witnessed a breakdown in my ex-boyfriend that scared me absolutely senseless. He had just been prescribed new medication, and for whatever reason, his body and mind reacted to it in the most horrific way imaginable. He'd had hallucinations before, but the new meds amplified them into something far more dangerous. The worst part was the blackouts. He would do things, have entire conversations, and have absolutely no memory of them afterward. It started with phone calls. He would call me screaming at 3 in the morning, ranting about things that weren't there, people who were watching him. The next day I'd ask him about it, and he'd just look at me, completely confused, with no recollection of any of it. He'd swear he'd slept through the night. It was like talking to two different people. The man I knew, and the terrified stranger who called me in the dead of night. The instance that I will never forget, the one that still makes my skin crawl, happened during one of those 3 a.m. calls. His voice wasn't frantic or screaming this time. It was quiet, eerily calm. "I boiled some water," he said, his voice flat and distant. I was half asleep, confused. "Why?" I asked. "It's the middle of the night." There was a long pause on the other end of the line, just the faint sound of his breathing. Then he replied, his voice still devoid of any emotion. "They told me I have to stick my hand in here." It was absolutely terrifying. I was miles away, completely helpless, listening to the man I loved, calmly contemplating a horrific act of self-mutilation at the command of voices in his head. I started pleading with him, begging him not to do it, trying to talk him down, my own voice shaking with fear. I don't know if I got through to him, or if he just got distracted, but the immediate crisis passed. The next morning, I finally convinced him to go to the hospital to ask for a medication change. He begrudgingly obliged. While he was there, waiting to be seen, he started throwing up blood. They rushed him into emergency care and had to pump his stomach. It turned out that during one of his blackouts, sometime in the night before he called me, he had swallowed his entire bottle of medication. The horrifying breakdown, the calm discussion about boiling water, it was all the result of a massive overdose he didn't even know he'd taken. He had no memory of it. None at all. Story 8. I'm not a psychologist, but as a registered nurse on an acute psychiatric unit, I've seen my fair share of frightening situations. You get used to a certain level of chaos. I've been assaulted, threatened, and I've had to restrain patients in psychotic states who possessed a strength that seemed otherworldly. You learn to build a professional wall, to see the illness, not the person, as the source of the aggression. Most of the time, that wall holds. But I had one patient, a young girl, who shattered it completely. What she did wasn't just scary in the moment. It was a unique brand of psychological terror that seeped into you and left you feeling stained long after. She was 17, diagnosed with severe schizophrenia. Most of the time she was lost in her own world, muttering to herself or sitting completely still for hours, staring at something only she could see. She was thin and appeared fragile. If you saw her on the street, you would never imagine what she was capable of. Her trigger was a mystery. Without any warning, she would switch from a catatonic state to one of focused, malicious aggression, and she had a preferred target. Me. The first time it happened, I was doing my nightly rounds. The unit was quiet, most patients in their rooms. I saw her crouched in a darkened corner of the hallway, as if trying to fold herself into the wall. This wasn't unusual for her, so I didn't think much of it, just made a mental note to check on her more closely later. As I walked past her, she lunged. It was a blur of motion before I could even raise my hands to defend myself. She shoved her hand down the front of her pants into her vagina, grabbed a handful of menstrual blood and slapped me across the face with her open, bloody hand. The initial shock wasn't pain, but pure sensory overload. The wet, slapping sound, the sudden warmth and slickness on my cheek. And then the smell, a thick, coppery odor that filled my nostrils. It took a full second for my brain to process what had just happened. I looked at her, and she was smiling a vacant, disconnected smile as blood slowly dripped down my face and onto my scrubs. Protocol kicked in. Other staff members rushed to restrain her. I was hurried to a decontamination room to flush my face and eyes, and then began the part that would become a horrifying routine. A trip to the main hospital's emergency room still during my shift to get my blood drawn. HIV, hepatitis B, hepatitis C, the full panel. This wasn't an isolated incident. She did this to me more than once. I became her targeted worker. The fear changed from a sudden shock to a slow, creeping dread. My daily life on the unit transformed. I started mapping out my routes to avoid corners where she might be hiding. Every time I saw her, my body would tense up, bracing for an attack. The dread was constant. Seeing her crouch down the hall would send a jolt of pure adrenaline through my system. It was a disgusting, deeply personal form of assault, and the worst part was the helplessness. We couldn't reason with her illness. All we could do was contain her after the fact, clean up the mess, and send me back to the ER for another round of blood tests and anxious waiting. The fear wasn't just about contracting a disease. It was the profound sense of violation, the feeling of being marked and hunted by a patient in such a bizarre and grotesque way. No textbook or training could ever prepare you for a horror like that.